Welcome to Cardiac Devices. You can find this on pages 82 and 83 of your Nurse Workbook 2.0, or go ahead and print the pages below this video so you can follow along with me. The purpose of this video is to go beyond the Nurse Workbook 2.0, but provide you with real-world nursing education as well. We want to go beyond just trying to pass a test, but teach you real bedside stuff. So we just got done talking about cardiac arrhythmias in our prior video and how to spot those on the EKG. Well, what about our patients that can have a normal sinus rhythm, but then they say that at home they felt something funny, or maybe they fainted, or maybe they have this underlying cardiac issue, but it's just not coming up while they're at the hospital and on the monitor? Well, there's something we could do called a cardiac device, and there's a few types of them. And so today we're going to talk about these devices because we can't just keep people at the hospital to watch them for hours or days or weeks just to see this one instance of what their heart's doing, because heart rhythms can change rapidly. They can change very quickly, but it also can be dependent upon what kind of activity they're doing. So we're going to put these devices on them and monitor them from home. So our first cardiac device we're going to talk about is an implantable loop recorder. And this is going to be a 1.5-inch device that's going to be implanted in the chest subcutaneously. And this loop recorder is going to monitor a patient's heart for up to 3 years by the single lead EKG alone. And this is how it works. The patient's going to get this loop recorder placed under their skin, and the single lead EKG is going to monitor them through every second of their day. And then when the patient has some kind of fainting or some type of cardiac episode, the monitor is going to pick this up and it's going to send data to the hospital or to the cardiologist. And from there, the cardiologist is going to analyze the data and call the patient to talk about what their potential diagnosis could be based on the rhythms that are presented. And our second device is going to be known as an ICD, or this is going to be an implantable cardioverter defibrillator. And this is going to be a battery-operated electronic device that is designed to prevent cardiac arrest from any tachyarrhythmias. An ICD typically lasts 5 to 7 years, depending on the usage and the type of device. And the implantable device senses the arrhythmia and it causes the ICD to fire or send a shock, like it's giving a hard reset to the ventricles when they act irrationally. And if the electrical impulses are interrupted, the heart can beat too slowly. This requires pacing, and sometimes this can be combined as a pacemaker defibrillator implanted device. However, not all ICDs actually have pacemaking capabilities. But if someone does have a pacemaker, there's actually multiple forms of pacing. So pacing can be permanent. That's a small device under the skin. This is typically going to be near the collarbone that continuously monitors and, when necessary, regulates the heartbeat over a long period, or often the remainder of the patient's life. We can also have an implanted version, and this implanted pacemaker is surgically placed to deliver electrical impulses through leads or wires in the heart muscle to maintain a regular heartbeat. We can also see this as a temporary pacing. Temporary is used for short-term heart rate regulation, and this is often during a hospital stay or until a permanent pacemaker can be put in place. We also have transcutaneous pacing, and this is known as those pacing pads that we put on top of the chest, and we're able to dial the amount of electricity and how fast we want to pace. And the biggest thing to note here is you want to make sure that your patient is comfortable. Pacing can be very painful, especially if you're requiring more electricity. So we want to make sure that we have adequate pain control, or potentially we're sedating our patient for this moment. And there's also transvenous or epicardial pacing. And this is going to involve leads that are going to be threaded through the veins of the heart, while epicardial pacemaker leads have attached directly to the heart surface. And when we know our patients have pacemakers, there's a couple questions that are super important to ask. Most of our patients are not going to be able to answer any of this, But if they do carry their pacemaker card on them, or they know some of this information, it's going to help speed up the process quicker so you can talk to the cardiologist or interpret whatever it is you need to do because you have some of your answers. So your important questions to ask will be, what kind of pacer is it? So we want to know this because, again, we need the pacemaker interpreted. If something's happened or the patient said something has happened or it fired, we need to get that moment interpreted. And since there's many different devices of pacemakers, we need to call the right company that's going to be able to interpret their pacemaker. What is the indication? So why? Why did they get a pacemaker to begin with? What is kind of that underlying cause that they needed the pacemaker? What are the settings? And I have yet to see anybody that knows their settings, but this is typically on their card. But this is a great thing that you're able to chart and document for the cardiologist if need be. And then you want to ask for the ID. And again, a lot of people won't have it on them. However, it's really great if you do. And quickly, I wanted to squeeze in this last little rhythm because we didn't talk about it in our previous understanding EKG rhythms lesson, but this is a great spot because this absolutely requires a pacemaker without a doubt. I also have a very dear friend that recently got diagnosed with this, so it's crazy critical to spot if you happen to see it because it can be fatal. So what is sick sinus syndrome? Well, this is also known as tachybrady syndrome and is a group of heart rhythms that are due to the SA node not firing appropriately. So we're going to see alternating bradycardia and tachycardia with pauses and stops in our rhythm. And because of all the flipping of rhythms, the patient's cardiac output is going to be compromised and it can go into cardiac arrest. So if we look here in this Brady part, we see this really long pause followed by recapturing and then into this tachy rhythm here. My dear friend that I talked about actually went into cardiac arrest during her shift while working in the emergency department. So this is very important to recognize. If you happen to see it on the monitor, it requires a quick intervention. And 3 facts about sick sinus syndrome is that it's typically caused by scar-like damage to the heart tissue. And it can cause this alternating tachybrady with pausing, stopping. And it is uncommon, but it does need emergent attention. That is it for our cardiac devices lesson, and I will see you in the next one.